Hi, my name is Dr. Monisola Adanijo. I'm a cardiologist and you can call me your favorite doctor with a heart. Today we're going to be talking about stroke. I'm sure many of us know at least one person that has had a stroke before. So tell me, what exactly is a stroke? A stroke happens when the blood supply to a part of the brain is cut off suddenly. The person can either experience a loss in function of one hand and one leg, his face becomes asymmetrical, or his speech becomes slurred. Sometimes when a person has a stroke, the person actually falls to the ground, collapses, or as what people normally say, the person slumps. A stroke doesn't just happen, okay? Usually there's some risk factors that are in place before a stroke happens. Now, a risk factor could include family history of a stroke, if the individual himself is hypertensive and the blood pressure is not well controlled. Diabetes is also a risk factor for stroke. So is cigarette smoking, high salt diet, sedentary lifestyle when the person doesn't exercise, high cholesterol, taking of illicit drugs could also result in a stroke. Other things that could cause a stroke include infections like HIV. How do we prevent a stroke? It's quite simple. To prevent a stroke, we need to prevent and treat all the risk factors. Now, it's not possible to prevent your family history, okay, so that is non-modifiable. But there are some things that you can do with yourself to prevent a stroke. You can prevent a stroke by controlling or preventing the risk factors. So if you're hypertensive, you need to control your blood pressure. If you're diabetic, you need to control your blood sugar. If you have high cholesterol, that needs to be under control as well. Exercise is extremely important in controlling hypertension as well as diabetes to prevent a stroke. Low salt diet and avoiding a sedentary lifestyle. When a person has a stroke or someone is having a stroke in front of you, the person needs to be rushed to the hospital as soon as possible. Now, when somebody is having a medical emergency, it's not the time to launch into extensive prayers. That's not the time to go to the pharmacy. At this time, you need to rush the person to the hospital for urgent medical attention. Now, things like hypertension and diabetes, you need to screen for them before you know you have them. So it's important to do your yearly checks. So every year you need to check your blood pressure, you need to check your blood sugar, you need to check your cholesterol, and make sure all these are controlled. Now, when you're told you have hypertension, or you have diabetes, or you have cholesterol, it's important you follow your doctor's instructions to avoid complications like stroke. Now, apart from stroke, all these things can cause other complications like heart failure, kidney disease, and all that. But we won't talk about that today. That will be spoken about at a later date. It's okay to chase the bag, okay? And it's okay to work hard. But we need to remember that it's only the healthy that make money. So while we're working hard and while we're going around our daily activities, it's important to get our health in check as well. Once again, my name is Dr. Monisola Adanijo, consultant cardiologist and your favorite doctor with a heart. For more health tips, you can follow me on Instagram, Moni_Adanijo, on Facebook, Diary of a Lagos Cardiologist, and I'm also on LinkedIn, Monisola Adanijo. Stay safe, stay healthy, until the next time.